Today we'll be speaking on a very a crucial topic that most people don't really like talking about, but it's very common in our society. And people tend to stigmatize or keep those people outside that have this condition. But no, today we are going to be learning about it and how we should relate with even those who have it. So the title of today's health talk will be HIV and AIDS. HIV and AIDS. Key fact: HIV remains a major global public health issue, having claimed an estimate of 42.3 million lives to date. Transmission is ongoing in all countries globally. So it's not only Nigeria, it's not only in Africa, in Asia, in every part of the continent, this condition is ongoing. There was an estimate of 39.9 million people living with HIV at the end of 2023. That was last year. 65% of whom are in the WHO African region. So 65% of people that are living with HIV are found in the African countries. In 2023, an estimate of 630,000 people died from HIV-related causes, and an estimate of 1.3 million acquired HIV. There is no cure for HIV infection. However, with access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infection, HIV infection has become a manageable chronic health condition, enabling people who are living with HIV to live long and healthy lives. So HIV is not the end of the world. When an individual is infected with this virus, after that person maintains a healthy lifestyle, that person can live for as many years. If that person is as healthy as that person can be, that person can live longer than people who don't even have this virus. Without treatment, HIV infection can progress to AIDS in about 10 years. Some people can't get AIDS without HIV. So someone can't get AIDS without HIV. So HIV comes before, then AIDS is afterwards. It is a false belief that only certain people can get infected. Anyone is prone to the infection if exposed to the virus. So anyone can get this infection if you are exposed to the virus. Now, what is HIV? Human immunodeficiency virus is a virus that attacks the body immune system by destroying the T cells and making the immune system weak and unable to fight other disease. So now this is a virus that has a way of going to one's immune system, destroying it down, killing what we call the T cells, and making one vulnerable to other diseases. That is why when an individual has HIV, the individual is prone to many other diseases because the immune system has become so weak and cannot fight other diseases. So you see that today the person is having malaria, tomorrow fever, the next tomorrow he has diarrhea, another day vomiting, and it comes back, and like this keeps on going. Acquired immunodeficiency syndrome, AIDS, is a final and most serious stage of an HIV infection. HIV targets the body white blood cells, weakening the immune system. This makes it easier to get sick with diseases like tuberculosis, infections, and some cancers. Symptoms. What are the symptoms of HIV? Fever, chills, fatigue, that is extreme tiredness, sore throat, loss of appetite, persistent diarrhea, vomiting, recurrent infection. That's that person, when we're treating one infection, the next another one is coming, and it's just coming back to back. That's what we call persistent infection. Muscle ache. All your muscles will be paining you. Night sweat, rashes, swollen lymph node, mouth sore, unexplained weight loss. The person just be losing weight and can't even pinpoint what is the cause of this weight loss. And it's excessive. Not that somebody just drop 1 kg. You can see the person just drop up to 5 kg at once. And nothing is responsible for that. Not that the person is not eating well, or the person is being stressed, or all that. The person just loses weight just like that. What does HIV do to a person? HIV infects the white blood cells of your immune system called the CD4 cells or helper T cells. It destroys CD4 cells, causing your white blood cell count to drop. These white blood cells are the ones that fight off disease. It causes it to drop. This leaves you with an immune system that can't fight off infection, even those that wouldn't normally make you sick. So if probably you have malaria and you might be the person that okay, even though I have malaria, it doesn't really show. Once HIV comes into that individual, even little mosquito that bite that person comes down immediately with malaria. Stages of HIV. We have 3 major stages of HIV. They graduate from each stage to another. So the first one is the acute HIV, stage 1. Now, some people get flu-like symptoms a month or 2 after they have been infected with HIV. These symptoms often go away within a week to a month. So now, this first stage, it is when the person has contracted the virus newly. And that person, at that point, may be having something like runny nose or catarrh, and it might last for a few weeks and it will disappear. Now, the second stage, which is the chronic stage. Now, this first stage, any person that has this HIV at this first stage can transfer it to anyone. The second stage, which is the chronic stage or clinical latency, is after the acute, you have the HIV for many years without feeling sick. This place, your body will be at rest. You feel like you are okay, nothing is going on, but the virus is there doing its work. It is important to know that you can still spread HIV to others even if you feel well. The stage 3, which is the AIDS, this is the flu-blown one. AIDS is the most serious stage of HIV infection. In this stage, HIV has severely weakened the immune system, and opportunistic infections are more likely to make you sick. These are the places that you see those people that they have gone into full blown. The thing has come, they feel some symptoms, it was away. Where's the way? The first stage. The second stage, it has come, and the person is not feeling anything. We call it the chronic stage. Latency, that stage is not really active. Then the last stage is when the thing has become full blown. That one, all the old symptoms will manifest at once.